You're listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, you're listening to the myPET podcast. My name is Aria and I'm joined by our resident vet and rounder-upper of muddy ponies, Dr. Glenn.
Hello.
How are you going?
Good.
On a scale of 1 to Peppa Pig, how muddy are your horses?
At the moment, very Peppa Pig.
Very Peppa
Maybe
Pig.
even Daddy Pig. Yeah.
Oh, gosh, yeah, okay.
Yep.
Yeah, mine are about the same.
Yep. Having a very wet season here in Queensland.
Yes, right now, lots of rain.
Yep.
It's lovely.
You can't have grass without mud, Dad used to say.
I like that. That's cute.
But mud sucks with
Yeah,
horses. Yep.
yeah, but we're here to discuss what the problems are with mud and what we can do about them and how we can prevent them. So this is just general advice for advice specific to you and your horses. Have a chat to your horse's vet. So let's get stuck into what...
Let's get stuck in the mud.
Yeah, let's get stuck in the mud. All the problems that it can cause. Firstly, I have a very important question. One that I've been wanting to ask a veterinary professional for a long time.
Right, I'm worried now.
Is it true that the paler colour the horse's coat, the more muddy they will get?
Anecdotally, I would say yes, that is correct.
Okay, because I think I can do a clinical study on that and find pretty resounding yes.
Put it this way, if you had a horse that was all white on one side and all dark on the other side, the white side is the one they would lie on. Yes.
Yeah, absolutely. Yeah. I have paint horses and they are, they're very prone to mud.
Yeah.
My black quarter horse never rolled in the mud.
Some would say it's just more obvious and there's probably just as much mud on the bay horse, but it's just less obvious.
That's rubbish. It's not true. No, so let's get into the real muddy problems.
Yeah.
So there's a number of places where things can go pear-shaped in wet, muddy weather.
Yep.
And the skin is definitely one of them.
Absolutely.
The skin around their pasterns seems to be the one that...
First spot that goes, and particularly troublesome, yes.
Yeah. It has a billion different names.
Yep.
Greasy heel, mud fever, I know.
Greasy heel, mud fever, grease heel, rain rot's a bit higher up. But yeah, lots of different names for essentially the same sort of group of things that are happening, and depending on the cause of them and depending on the severity of them, and depending on where you live in the world, or probably live in Australia, they get called different things.
Yeah. So what is it?
Most of them stem from the bacteria and fungi like hot, wet, moist conditions, which is what happens, and the pastern, which is the back of the leg basically below the fetlock, it's close to the ground, it's in the wet grass, it's in the wet mud, and it's complicated. It's got short hair on it, and that probably makes it, in general it's got short hair on it, and that makes them more prone to troubles. But if you've got a feathered horse, like a draft horse or something, having really long hair makes it worse as well.
Yes.
And if you're in a cold, wet winter climate, the longer the hair is, more likely to be. And when it's really hot and humid in the tropics, the extra heat and humidity makes bacteria and fungi grow better as well.
Yeah. And, when they're sinking ankle deep in it, it's just, there's no escaping it.
It's just wet all the time.
Yeah. The symptoms are like pink skin, itchy.
So it's... it depends a little bit on the cause, but they sort of all end up looking the same a lot of the time. You'll just get this pastern dermatitis, so it's usually the skin above the frog, just right on the back of the pastern. Gets red, gets inflamed, might start with a pussy ooze, and it gets a scab on it. It's usually itchy, so sometimes they'll be sort of scratching it and self-traumatising it, turning around and chewing on it. You'll see them chewing on their front feet, occasionally chewing on their back feet, but they'll end up rubbing it on things, posts and sticks and stuff like that because it's itchy, which causes more trauma. And whenever there's some oozy stuff, that attracts flies and biting flies and midges, which probably makes it even more itchy. So sometimes there's specific causes, sometimes there's non-specific causes, and it all ends up sort of looking like this rotten, smelly, sore, horrible patch of skin.
Yeah. And in severe cases, the whole leg can puff up.
Absolutely,
really.
Yeah, they start getting swelling at the side and they start socking up, and if they're feeling unwell and they're moving around less, or if it's too wet and they don't want to move around, the less that horses move, or the more likely they are to get skin swelling. And the more swelling they've got, the more likely it is potentially, if there's a few bacteria that get in underneath the skin through those wounds, well then you've got cellulitis and infection, and that's where you start to get like mud fever, where they actually start running temperatures, and it becomes like a systemic illness potentially, where you've got bacteria beyond just the skin surface.
Yeah. So like mild greasy heel, what are the treatment options for that?
I mean, it's essentially trying to keep the area as dry as possible, trying to keep it as clean as possible, get rid of, by means as gentle as possible, the scab and ooze that's there. So that's usually involves like soaking it in something. So whether that's like an antibacterial shampoo or some sort of emollient cream to soften it up, or Vaseline, or all sorts of things get used to soften things up. Certainly I would never scrub at a lesion like that, because it's just going to make it sorer, but you're just trying to soften as best as possible, irrigate it off to get rid of as much stuff as possible, reapply a antiseptic of some sort to reduce bacterial and fungal growth, and then try and keep it dry, which is really easy to say if you're on a podcast but haven't got 1 or 10 wet horses at home.
Or 50 or 100 or 300. Keeping it dry doesn't always look like bandaging it.
No, it's a hard one, because, I mean, bandaging, like some of these lesions, we do prefer to bandage because you can better control the skin situation and stop that scab and ooze from building up at the skin surface, because the bandage absorbs that. But if the bandage absorbs moisture from the inside, if you're still out in the paddock and it's wet, well, that bandage is wet straight away, so that doesn't work. We all know horses go really fast when they want to, and bandages, can slip. Bandages can put extra pressure on places, so it gets complicated. So sometimes you prefer to have them not bandaged, but obviously out of the weather is the best spot for them.
And with this sort of like Paston dermatitis, what are the red flags that it's time to call the vet out?
For me, call your vet any time that you don't feel comfortable with what's going on, for a start. But if you've got lameness, if you've got significant swelling, if you've got significant breaks in the skin, I would never say don't ring the vet. I mean, and because there's multiple different factors that cause it, there's general bacterial overgrowth that can cause it, but there's also specific bacteria that getting a diagnosis on those specific bacteria is important as well. The Actinomyces style bacteria that causes more damage to the skin than a non-specific secondary overgrowth. And then, is it fungal infection? And you've got to go harder with antifungal agents, because some topical agents are just antibacterial, some are singly antifungal, and some are antibacterial and antifungal. So getting a diagnosis on what you're actually dealing with is a really good idea. And there's a small subclass of those hairy fetlocked horses, mostly draft horses, but sometimes there's mites involved. Like it's actually like parasites that are there that need insecticidal treatment as well. Or a combination of all of the above.
So speaking of bacteria in the skin, then you have rain scald, which is higher up. So what is rain scald? Is it the same kind of thing but just on the rest of the body?
It's the same specific bacteria that can cause troubles down low, the dermatophilosis. It's an Actinomyces style bacteria, so it's a bacteria that sort of behaves a bit like a fungus.
But
it's still a bacteria. So it behaves like a fungus, as in it gets little mycelial branching growths on and through the skin, which makes it quite aggressive. Also makes it a specific organism that can get transmitted via rugs or brushes or cleaning agents and stuff like that. So it's potentially like a herd problem. It's a specific bacteria that we see it mostly in younger horses because they get an immune response to it and sort of become immune to it. So classically you'll see it in like weaners or yearlings in wet weather. And the rain scald is just if they're in the rain a lot where the skin is wet, you'll just get this painful, weeping, oozing dermatitis that gets a crust on it, like they're getting possibly on the paston, because it's the same bacteria some of the time.
Yeah.
And you get it in the rain run lines, like where the hair directs the water down the sort of near the flank of there, in particular, and down the back of the hind leg. So you'll get these sort of scalded areas where the hair will start to lift off and the skin will start to lift off because it's all pussy and oozies. Thus, rain rot, rain scald is the name.
Yeah.
But it's can be pretty nasty. Yeah.
Yeah, and the treatment for that's similar in that it's like softening them and using an antibacterial, antifungal.
Antibacterial, antifungal. Sometimes when your vet's involved, using systemic antibiotics that are appropriate for that particular bacteria.
Yeah.
So again, getting a diagnosis is a good idea. And, some vets will take samples of that and send it off to the lab, or you can sort of see it stained up underneath the microscope and diagnose it that way a lot of the time, if your vet's got their microscope with them in the back of the car, etc. But yeah, it's a primarily bacterial problem that, again, keeping them dry, easy for me to say, but out of the rain makes it a lot less likely to happen. They were working on a vaccination for it at one stage, but hasn't come to fruition. I mean, areas that get intense rain and lots of rain, like, it can be a really big problem, and then a lot of areas you rarely see a horse with rain scald, but depending on the weather conditions, like if you get unseasonal, a couple of weeks straight of rain or several days of really intense rain, you can get multiple horses in the same paddock with it because they probably could off each other, etc.
Yeah. Is it the kind of thing where it's like naturally there's a little bit of this bacteria there, and then the wet conditions just make it
worse?
Like, as far as keeping them dry in hot, humid summers like we have in Queensland at the moment, putting a rain sheet on them isn't necessarily the best thing, I'd imagine, because then they're sweaty under that.
Correct. Yeah, it's really difficult because it's when it's hot enough, you don't want anything on them. I mean, you can get really light rain sheets. I mean, even like the mesh style rugs, maybe that helps to run some of the water off. But yeah, I mean, my horses are nude at the moment. Because it's just too bloody hot. Yeah.
Same. It's just because there's the evaporative effect of them being able to sweat is what cools them down.
But certainly, cooler climate conditions, rain sheets, definitely make a big difference because you're not getting that contact with the skin of being wet all the time.
Yeah. Is there any way that you can prevent rain scald other than having a nice dry shelter or stable?
Lots of stables. Basically, no. I mean, look, if you knew that there was one horse in the herd affected, I mean, potentially like preemptive antibacterial shampoos and washes and that sort of thing, potentially if you're trying to stop it spread in a herd situation, that could help. But really, it's a bacteria that's not... Yes, it's spreadable potentially from horse to horse, but it's in the environment as well. So it's not something you can ever get rid of as such.
So the next place that mud causes problems with horses is their hooves. It's a big one. It's like the bane of every horse owner's existence.
Pretty much.
When an area has had a lot of rainfall, I will see lots of orders come in at Vet and Pet for like poultices and like all the sort of stuff that you need to treat a hoof abscess from that area. So I can always tell where there's been somewhere with lots of rain.
Yeah, and horses they're herd animals, but they're really frustrating when you've got a big paddock and there's no mud over there, but you're standing in the gateway here where all the mud is. Go and stay somewhere else.
No.
But they don't.
No, they don't. That would be too sensible. So let's go through the hoof problems that happen in wet, muddy conditions. When obviously the hooves are like nails, so when they get soft, that it causes all sorts of problems.
Yeah, I mean, they just haven't got the same structural protective mechanism in place. So just, if they're wet all the time, the sole ends up getting softer and more supple than normal, which is a bad thing if you then stand on a rock or a stick or something hard in one spot. So, I mean, they can get non-specifically tender-footed, even if they haven't got any other specific problems, like just because it's wet and soft. And then that can cause problems with, a sensitive sole can become a stone bruise, which can have a bit of hemorrhage and then makes it more likely to get a hoof abscess, which is rotten feet troubles as well.
Yes. And I think probably one that I have dealt with a lot with my horses is thrush or like fungal infections.
Yep.
Just from being constantly wet.
Yep.
So what is that? Like, how does it happen?
Yeah, so thrush is, so you got the structure of the horse's hoof, you got the hoof wall and the sole, and then you got the frog bit at the back with the little V shape, and it sort of tends to be softer than the sole because it's more flexible as part of the blood pumping mechanism, etc. But because it's softer, it's more able for water to penetrate into it, and it's easier for, I think, fungal organisms to invade, and they get thrushy, which just means you've got a fungal infection and it gets like a chalky white sort of look to it sometimes and smells really funky, and then you get little abscesses in it sometimes and it's just all rotten and disgusting. And sometimes they like slough off and the whole frog sort of falls off. The cornified bit, or what should be the hard bit, and then you've got the soft, exposed, sort of quick layer underneath, and that's not much fun. Or you've got infection deeper underneath there, and the soft, spongy stuff that's all chalky is still on top, but you've still got deeper infection underneath. So it just goes funky everywhere.
Yeah. And so what is treatment? What sort of treatment do you use for this sort of thing?
Yeah, so I mean, thrush, you've just got to get in there and clean out all the damaged tissue as best as possible, and then it's usually antiseptic, whether that's like a strong iodine solution or there's various treatment ointments and that sort of thing you can put on that are antifungal in effect, but also try and keep some of the water out and also treat the infection basically, so make it as healthy as possible.
Yes.
Yeah.
Yeah, I struggled with this a lot with my horse at my last place because it was very flat, very black clay mud, and the water would just pool, like it wouldn't run off because it was so flat. So then there was nowhere elevated, so everywhere just got wet. So yeah, we dealt with it a lot there. So and because her feet would get so soft, like if I was picking them out, I'd often just use like the bristle of the brush just to like flick all the mud out, make sure there's nothing in there, and then spray some iodine in there to try and prevent it from getting any worse.
When it's soft, like you can't just pare away all the soft tissue because you're going to have some more soft stuff underneath. But you've got to try and clean it up so your antifungal stuff is having some sort of effect.
And as far as like paring things away, I'd just get my trimmer out.
That's the best idea. And again, if you've got any significant lameness, get a vet involved as well. Because you don't know what's going on until you know what's going on. Because,
absolutely.
I mean, plenty of horses have got thrush as well as a sole abscess, and if you've got infection going from a sole abscess up the hoof wall, well, you've got trouble. So if you've got significant lameness, get your vet.
And I just think you don't want to be paring away at a hoof unless you know what you're doing.
That's right.
So hoof abscesses, that's like that's the big boy that I think the mud causes.
I mean, again, it's a big problem, and a couple of different mechanisms there. The soft soles getting a stone bruise, certainly that makes them more prone to getting an abscess, but there's also like the hoof, and as often happens, you have a drought and then you have flooding rains, and the horse's hoof is really cracked and dry, and you've got these little micro cracks everywhere, and the horse's hoof isn't a sterile spot in the first place. It gets really wet, and those little bacteria get through the little micro cracks and get to where they've got a food source, anaerobes, so there's no oxygen in there, which is why it smells really funky, and they grow in anaerobic conditions and make gas, which makes swelling, and start levering off soles and heading up white lines and all sorts of stuff. So you don't have to have a physical penetrating wound to get a sole abscess. You don't have to have a sole bruise. They make it more prone to troubles, but just a horse's hoof that's wet and spongy can get a sole abscess as well.
And like, I mean, if anyone's lucky enough to not have had one, what do they look like?
I mean, just really, really painful as far as the horse is concerned. I mean, on the outside, a lot of the time you can't see anything because it's underneath the sole, and that's the problem. So you need a vet or a farrier with hoof testers to see what's going on. If the infection stays there for long enough, depending on where it is on the sole or the foot, it can come out via the path of least resistance, basically. So they'll end up coming out like through the back of the frog,
Yeah.
where the hard stuff joins the sensitive stuff. So you'll end up with pus draining out the back of the frog. Sometimes it'll come through the sole where the abscess is formed. Sometimes it'll end up going along the white line and up the hoof wall, so you'll end up swelling at the coronary band, so at the hairline, anywhere around the hoof. And you don't want that to happen, because the more tissue it damages, the more tissue it disrupts, the deeper the infection is, and the more trouble it can cause.
Yeah. And what is the treatment for hoof abscesses?
Most of the time it's just draining them, exteriorising them, so finding out exactly where it is, and then paring down and exploring it, getting rid of that horrible gas and pus that's in there, and then packing it with antiseptics and keeping it dry and clean, and letting nature take its course and heal it up. But it gets more complicated if it's already busted out the coronary band, or if you've got, you can get secondary sensitive tissues that are infected, and antibiotics and everything else that goes along with it. But a hoof abscess doesn't need antibiotics, because it's not in the body unless it gets in the body.
It's not in the body until it is. Yeah. And an abscess travelling up the white line is different to white line disease or CD2, is that right?
It is, yeah. I mean, the white line disease, CD2, tends to be, again, like fungal organisms. I mean, there's probably bacteria involved as well, but it's just, again, it's probably the same organisms that are causing the thrush at the back. It's just eating tissue that's available to be eaten. The white line's the little connector between the sensitive tissue and the hard hoof wall, so it's the softest spot, again, the area of least resistance, and you can get gravel, which is a condition where it's muddy. If you haven't got shoes on your horse, little bits of grit and small rocks that are in the mud, because the horse's hoof is soft, it gets poked up in that weak spot, basically, so it can start to cause troubles. But basically, if it's wet, there's more funk, there's more infection.
And grass seeds, which is apparently why it's called seedy toe.
Can do, because, I mean, basically you end up with like a V-shaped wedge, basically, so like the white line dissolves away, gets eaten away, and then anything can start to poke up in there, and then it acts like a wedge and levers stuff apart. But it often starts with wet feet. And it's one, like, again, with the cracks at the front of the hoof. I feel like that's a big warning sign. Absolutely.
For that. And so treatment for white line disease, what is that?
Again, paring out the damaged tissue, but that could be very close to the sensitive tissue, and I mean, it's like, depending on the size of the horse, 5 to 8 millimetres before you get to the pedal bone. So it gets pretty complicated. And antiseptic stuff to stop the infection, and time to allow normal tissue to grow down while maintaining a as less bacterial, fungal environment and as dry as possible.
That's it. And with white line disease, it's like dry and lots of airflow in there, so it's I've seen all sorts of interesting ways that hooves have been opened up to sort of let that out, and it looks terrifying.
And there's lots of important stuff there.
That's it. So that's another one that it's like, and other than having nice, clean, dry stables and shelter, what preventative measures can be taken to try and stop these hoof things from happening?
I mean, there's lots and lots of different things you can do. I mean, obviously, yes, stables and shelter definitely is a big part of it, but practically depends on your circumstances. Have you got those places to put your horses? What's the paddock situation? How much room have you got? Do you own the place or do you rent the place? There's lots of different things to consider.
As far as hoof care goes?
Hoof care, I mean, certainly regular cleaning makes sense, because if the horse is in the paddock and you can't remove them from the paddock and they're still going to be in the mud, regular just picking out their feet and making sure there's not a rock wedged up in there somewhere that goes along with all the mud. You'll be earlier on to things like thrush and white line disease with regular cleaning, and also looking at the past and the skin side of things. You'll just be earlier to the game on that one. If you've got the ability to temporarily remove the horse from that situation, and give the horse's feet a good clean out to where they can get, dry or drier. You can start using things like hoof oils and emollient and antibacterial, antifungal creams and lotions and potions
Yeah.
to try and just keep the bacterial and fungal storm at bay.
Yeah.
Yep. And hydrating that hoof with all the oils, which is the way that it normally protects itself. I mean, that can be quite important.
Yeah. I put a dressing on my horse's feet like pretty much all the time. Every week I use a Conky's hoof seal, and I've found that it's been really great to keep her hooves not too dry and not too wet, especially when it's wet. I just find that it makes it easier to pick them out if there's something like that there. But then when they get wet, putting a hoof oil on there, or if they're too dry, can really help with all those cracks.
It helps both ways. I mean, it just backs up the horse's normal protective mechanisms for what's going on.
Yeah.
Yep.
And then as far as, like, there's also the nutrition side of things.
Yep.
Like, there's a lot of supplements out there, like, biotin that can help with hoof health as well.
Absolutely. The more healthy, the more healthy wall you're growing down, the better that's going to be. But if you've got a healthy hoof wall, you're more likely to have healthy white line and healthy frog and healthy keratin synthesis, basically. So if the hooves aren't growing at all, they're more likely to rot away. If you're growing new hoof and new keratin faster, you just got more protection there.
There's also some weird things that happen with mud and wet weather. Like, I've heard you mention swamp cancer before.
It's a terrible name.
It is. It
It's
sounds
a terrible disease.
It sounds terrible, and I don't really know much about it, but it sounds awful.
Yeah, it tends to be more of a tropical area problem. I mean, they call them swamp cancer because the horses can get lesions, usually on the underside of their body, legs and bellies, where they sit around if they've got access to water and swamps. So dams and stuff like that, horses will just hang out in the dam because it's cooler, basically.
Yeah.
But if they've got little abrasions and that sort of thing, they can get fungal infection. So it's a phycomycosis. It's a specific couple of types of fungal infections that gets into the tissue, and it just causes suppurative, which means sort of snotty, pussy looking lesions that look like they drain like an ectoplasm. Like, it's not pus, but it's not blood. It's sort of a bit of both, but there's sort of just a slimy algae looking ooze that comes out of them sometimes, the poor buggers.
So it's not actually cancer.
It's not actually cancer, but it spreads.
It's just nightmare
looks
juice.
like a cancer. Yeah, I've seen them as big as dinner plates or bigger within a couple of weeks or a month or something like that, because they just invade the surrounding tissue. So they're not common. They're quite difficult to treat, but they're a bit like cancer, as in a lot of the time you've got to try and cut them out to surgically remove as much of the infected tissue, and then use various antifungal stuff, and there's vaccines you can use for it.
Yeah, okay.
But it's not a particularly common problem, but you would certainly get your vet involved if you had a ulcerating, bleeding, very itchy, draining snot lesion on your horse.
Hopefully before there's snot draining. Yeah.
Yeah.
Is there anything that people can do to prevent that?
I mean, again, limit access to really stagnant water sources where horses like to sit around in, but that's probably good for their hooves, as well as making them less likely to get greasy heel and everything else, as well as less likely to get swamp cancer.
Yeah, that's it.
Yeah.
So is there any other weird and wonderful things that you've seen?
Oh, there's lots of weird and wonderful things, but I mean, again, tropical melioidosis, which is a wet season bacterial infection that isn't really a skin problem as such. They just get sick and die and do other things, but it's a wet weather problem, more so in horses and camels and occasionally dogs and people and stuff.
Yeah.
There's lots of weird stuff. But
there is lots of weird
stuff. It's
stuff.
not very common.
Yeah. We won't worry people with weird stuff.
Yeah.
As far even if you don't have a nice dry stable, I have, and I've been honest in the situation where I've been renting, so I haven't been able to do a lot. So there are little things that you can do, try and do to manage the environment.
Yep.
So I'm a big fan of rotating my paddocks. So even on a rental property, I can just set up smaller paddocks with some electric tape, and make sure that I have good grass cover. So keeping it 5-10 centimeters long and no lower.
Yep.
Especially through spring when it's starting to get wet, I will often even just do a sacrifice area.
Yep.
So that there's good grass cover, because when there's grass cover, it's less likely to get muddy.
That's right.
And then, you know, even if the paddocks are muddy, well, I can sort of rotate them around them, you know, like every couple of days. So that they're not standing in the same muddy spot.
Yep.
And it gives the ground time to recover. And it also is good long term for your pasture as well.
Yeah. Well, I mean, all those things make a difference. Just depends on, how much you can manage for those things. That's for sure. And, and what your circumstances are.
Yeah, that's right.
But obviously, minimising the amount of the depth of the mud. You can have gravelled or built up areas that drain better and maybe feed animals there if you can on those spots, so they're not standing around in mud as much and they're not damaging the paddocks as much. So that's one thing. But again, you've got to have a very nice hard packed area for that to work well.
Yeah.
There's no point sprinkling gravel there because you're just going to get
It'll just sink.
gravel mixed in with mud, which might chew up their legs even worse.
Yeah, that's right. Yeah.
They can get synthetic geofabrics to put underneath that sort of thing, and tiles that you put gravel in amongst concrete or plastic ones that improve drainage for sort of those sacrifice sort of areas.
But if you're on adjustment or you're renting, it's just not possible.
Makes it hard.
And a lot of people are in that situation.
Yep.
Yeah, so it does make it really tricky.
Yeah.
But yeah, and I think horses, their hoof, the integrity of the hoof is really improved by movement.
Yep.
So when it's muddy, it's so hard to get them moving without slipping.
Yep.
So it's just
makes it tough.
It does make it really tough.
And I mean, prevention wise, in part of the treatment thing as well, like is it a wives' tale about horses with white hooves have more problems, or white legs have more problems?
Yes.
It's probably not really a wives' tale, because there is a problem with photosensitization, like sun-induced problems, and as part of that whole Paston dermatitis, greasy heel problem, like there is a photosensitization issue that happens, and the less pigment there is there, as in if you've got a horse with a white sock, leg, foot, it's more likely to get more sun exposure, and they can get like a vasculitis, which is inflammation of the blood vessels that are there. So the more sun that they get, potentially they're more likely to exacerbate the condition that's already there.
Yeah.
So obviously stables and shade can help with that. Bandaging can help to keep the sun off, but there's also the problems that go along with managing in wet weather. Things like filter back and like zinc oxide based creams, which are antibacterial as well as keep the sun off. That seems to help in most cases. Occasionally it makes them worse, which is difficult, but some horses seem to react to those zinc oxide style creams as well, but most of the time they're of benefit. And that's one of the potential sort of treatment options. But thinking about sun exposure, if you've got skin that is damaged, and that goes with the rain scald sort of things as well. I mean, if you've got hair loss and open wounds and unhealthy skin, the more sun that gets in there, the worse it's going to be potentially. So sun is part of it, although it's sun that's going to dry out the mud.
I know, it's just, I struggle with that with my girl. She's got 3 big white stockings and white feet, so...
and if it's summer, they've got a really thin coat as well. So,
So it'll be really sunny for a couple of days and she'll be out sunbathing because she refuses to be sensible and refuses to keep any sun protection on. And then, it'll be rainy and she'll have pink sunburnt feet. And
that's how it works.
But yes, filter back does help with her feet. Well, I think we've just about covered the mud as much as we possibly can.
A few mitigation strategies there.
So yes, I'm sure whoever's listening to this is probably covered in mud, as we will be this afternoon when we get home to our horses, I'm sure. Cool. Well, thank you so much.
Thanks, guys.
Thanks, bye.